just as you're thinking of them as they come up and you don't want to lose them, go ahead and chat them in the box. And then you all are muted upon entry, and you should be able to unmute yourself if need be. So with that, this is being recorded and this will be sent out to you. I will go ahead and I'm going to turn off my camera. Sometimes that kind of clogs up the system a little bit, and then we're going to go ahead and start. So this is Save Babies With Us, how to launch an effective stillbirth prevention campaign with immediate impact. And today's presenter is Thalia. Thalia.
Hi everyone, I am Talia Washington, and my background is in nonprofit management and K-12 education. I run an after-school academic enrichment program for low-income middle school students in the Washington, D.C. area, and I am the Count the Kicks ambassador for the D.C. and Maryland area.
Hi everybody, I'm Emily Price. I'm the Executive Director of Healthy Birthday Inc., the nonprofit that created the Count the Kicks public health campaign. Thank you so much for joining us today.
And once again, I'm Megan Ockett with Healthy Birthday Inc. as well. I'm the Associate Director of Programs, and I echo what Emily already said too. Thank you so much for joining us. And with that, we'll go ahead and get started.
So what is Count the Kicks? Put simply, we save babies. Here's how it works.
We're going to turn now to that GMA parenting alert about a free app. A mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes, so when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So within weeks after we appeared on Good Morning America, 2 more babies were saved. We have a highly effective, evidence-based stillbirth prevention campaign. We developed an early warning system for moms, and we are saving 1 in 3 at-risk babies in Iowa. Our campaign is ready to go and low cost, and we want to save babies in your state. Stillbirth is a significant issue that most people do not talk about. This CDC data that you see in front of you is national data that shows just how many babies are born still. We lose 23,500 babies every year to stillbirth in the US. 1 in 167 pregnancies ends in stillbirth. For African American moms like me, it's even worse. 1 in every 94 pregnancies among Black women ends in stillbirth. As you can see by these stats, African American women are more than twice as likely to lose a baby to stillbirth compared to her white colleague, neighbor, or friend. Hispanic moms are also at greater risk, and we find these disparities unacceptable. We have your state-specific data and packets that we can send to you, so please feel free to ask for one when we're done. Here's something that you may not know. Families are 10 times more likely to lose their baby to stillbirth than to SIDS. I'll say that one more time. Families are 10 times more likely to lose their baby to stillbirth than they are to SIDS. And that last fact is actually a good place for me to stop and share a little bit about my personal story. This picture in front of you is a picture of my family. My husband, Jason, and I are both 42 years old. We've been married for 10 years, and we both have graduate degrees and careers that we are very proud of. 8 years ago, we settled in the Washington, D.C. suburbs. We bought a house, and we started our family. In 2012, we welcomed our first daughter, Rowan, into the world. I was 34 years old then. And during that pregnancy, like so many other moms, I worried about all of the genetic issues that doctors talk to you about during pregnancy. And in our first year, I was terrified of SIDS. I feel like SIDS was something me and my mom group talked about a lot. But at no point during my pregnancy did anyone ever talk to me about stillbirth. And that stat, again, is really relevant. Families are 10 times more likely to lose a baby to stillbirth than to SIDS, but not once did stillbirth ever come up in a medical setting during my first pregnancy. In 2015, when Rowan was 3 years old, my daughter Rowan is in the white sweater, our oldest. In 2015, when she was 3, we were blessed to expect our second child. I was pregnant again, and we were expecting another girl. I was 37 years old then, but I had a normal, uneventful pregnancy. At 40 weeks, I went in on a Monday for a routine ultrasound and got thumbs up. Everything went well. And yet by the Friday of that same week, I noticed the baby seemed to be moving a lot less than normal. And on Saturday, the very next morning, we went in at 6 a.m. We went to the hospital, and they were unable to find a heartbeat. On Sunday, August 16th, 2015, our second daughter, Nev, was born still at 40 weeks and 3 days. She was 8 pounds and 15 ounces, and she was beautiful. We ended up having to say hello and goodbye to our daughter on the same day, and my life has not been the same since. No one ever said the word stillbirth to me at any point before that day, and never talked to me about kit counting, or never told me that as an African-American woman, I had a 1 in 94 chance of losing my baby to stillbirth. No one ever told me that. A year later, we were blessed with another pregnancy, and I actively sought resources and sought to educate myself to help me take more control of my third pregnancy. I found and used the Count the Kicks app. Much like the video you saw, I used it during my entire third pregnancy to count kicks and monitor my baby's movement during the entire third trimester. And I'm really happy to say, as you see in the picture there, our youngest daughter, Nadia, was born alive, healthy, in 2017. Nev would have been 4 years old today. This is the only picture that I have of our entire family of 5 together. And volunteering as an ambassador with Count the Kicks is how I honor her and how I hopefully save other moms from the pain that our family has been through due to stillbirth. So thanks for letting me share a bit of my story.
Talia, thank you so much. This is Emily. We're deeply grateful that you shared your story with us. And we're so proud of the fact that you're a Count the Kicks ambassador in the DC and Maryland area. So thank you, Talia. These 5 women that you see on our screen are the founders of Count the Kicks. They all lost daughters to stillbirth or infant death in the early 2000s, usually it was around the 2002-2003 timeframe. They all live in the greater Des Moines area, and they also were not told the word stillbirth or the importance of kit counting when they lost their daughters. And so they grieved together for a long time They were connected through mutual friends and pastors who realized they were all going through the same grief process together and wanted to connect them. And very long story short, after a long time of grieving together and getting to know each other's families, they said, what are we going to do with our grief? We have to do something. We cannot be this sad for this long. We have to do something with our shared grief. And so they quickly learned about research out of Norway that showed a 30% reduction in the country's stillbirth rate by simply educating and empowering expectant parents to track their baby's movements in the 3rd trimester of pregnancy. Megan?
Great. So yes, this is Megan. So this is a research article from Norway that truly started the entire campaign. This study found a 30% reduction in Norway's stillbirth rate when expectant parents were educated on the importance of and method for tracking fetal movement in the 3rd trimester. Dr. Ruth Fretz is a Harvard stillbirth researcher. She was part of the Norway study and is a member of our Count the Kicks Medical Advisory Board. You can read the full research study on our website, counttthekicks.org. So Count the Kicks is a method for paying attention to babies' movements. This is a highly effective method we teach moms. Count the Kicks teaches the method for and importance of tracking fetal movement during the 3rd trimester of pregnancy. Research shows the benefits of expectant moms tracking their baby's movement daily and learning how long it normally takes their baby to get to 10 movements. So after a few days, moms will begin to see a pattern, a normal amount of time it takes their baby to get to 10 movements. If their baby's normal changes during the 3rd trimester, this could be a sign of potential problems and is an indication that the expectant mom should call her healthcare provider. This is a document that we put together that we share a lot on social media, and we share with all of our state partners, and it's a really great resources for moms to truly understand how to track babies' movements and the importance of doing so. So at Count the Kicks, we pay close attention to data and research. It's very important to us. And so I just wanted to highlight quick our Iowa stillbirth data. That yellow line represents the national stillbirth rate, and the blue bar is our Iowa rate. Data is a year behind. So in Iowa, in the fall, last fall, we received 2018 numbers. CDC has not released the 2018 numbers for the US yet, but as soon as they do, we'll update this. One important thing to note is that the majority of the US has remained stagnant, where Iowa's rate has dramatically decreased. Of course, there are some years it fluctuates, but it's important to look at data yearly and on averages. For instance, a large syphilis outbreak or many other outside factors could cause a spike and so on. There are a variety of factors that could lead to an increase or decrease in a state's stillbirth rate. But one important takeaway in Iowa is that when risk factors like smoking rate and obesity rate have increased during this time frame, our stillbirth rate still saw a steady decline, while the rest of the country has remained stagnant. Iowa Department of Public Health has been a longtime supporter of our campaign, and we wanted to share this video of Kim Piper. She is the executive officer for the Center of Congenital and Inherited Disorders at the Iowa Department of Public Health. She's also the project director for the Iowa Stillbirth Surveillance and Prevention Program.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
Hi, this is Emily again. To show that Count the Kicks works outside of Iowa, we want to show you some stillbirth numbers from Illinois, the second state in which Count the Kicks launched. Through a private grant, we launched our campaign there in 2016, and you can see from these numbers provided by the Illinois Department of Health the true reduction in the number of stillbirths since Count the Kicks began in Illinois. So the year before we began, in 2015, there were 950 stillbirths. And again, we started in 2016, there were 936 stillbirths. And then jump ahead to 2018, the most recent stillbirth data that we have from the Illinois Department of Health, and the state of Illinois lost 850 babies. So a difference of 100 babies if you compare 2015 to 2018. We are deeply proud of those numbers because we know that means more families did not have to endure the loss of a baby in the state of Illinois. Over the past few years, we started expanding into additional states by essentially replicating what we have done with Count the Kicks in Iowa and in Illinois and on some of our other first states that we launched in. We now have contracts or partnerships with the 9 organizations or health departments that you see on the screen. Most of them are using their federal MCH block grant dollars to fund Count the Kicks in their state. If you have friends or colleagues in these states and would like to learn more about how our partnership has gone, we highly encourage you to reach out and vet us and the work that has been done with them in their states. Nothing has been more satisfying than a few months ago, we connected with a baby in Kansas that was saved because mom was using our app. They walked right into the health department to thank Kelly Marks, the woman who made the decision to bring Count the Kicks to Kansas.
So we've sent out more than 1 million pieces of educational materials to providers across the US. We offer 2 different kinds of posters, 1 brochure and an app download reminder card, all in English and in Spanish. We recently launched educational materials in Haitian Creole for Florida providers. Providers in your state can order these on our website, countthekicks.org, anytime they wish.
We also have a lot of additional free resources on our website, countthekicks.org, such as downloadable kick counting charts, childbirth education lesson plans. We have a lot of research. Remember I said earlier that we really take evidence and research very seriously, and so we have a whole page dedicated to research. We have a Count the Kicks FAQ in 10 languages. We have dozens and dozens of baby safe stories and videos and testimonials that are just amazing. Feel free to peruse our website and share any of those videos. We also have instructions on how to have the kick counting conversation with patients, because a lot of the time doctors might have some concerns and things like that. So we'll talk a little bit later about trainings that we offer, and we really help shed the light on how doctors truly can have a stillbirth prevention conversation with their patients.
So I'm going to talk just a little bit about the actual app itself. So what you see in front of you, and I'm holding up my phone, I still have the app on my phone. I am not having any more babies, but I still have the app on my phone. It's a free app. It's available in 12 languages. You can see them listed there. It's available both for Apple and Android products. And it's really easy. Again, as someone who used it myself, you can start your session, restart your session, or delete a kick, for example. You push the button and you literally sit down in the same place each day or each evening, and you tap the little foot, the little blue foot that you see there on the right-hand side every time your baby moves. You can set daily reminders to Count the Kicks. You can review your kick counting history yourself or take it with you to your doctor's office and review the history together. You can download it and share it with a partner, share it with family members. If you are expecting multiple babies, twins, you can do a kick counting session for multiple babies. And you can track future pregnancies in your same profile. So having one baby and 2 years later you have another, you can keep the same profile and compare and contrast. You can also have multiple devices registered to your account. So it's a really flexible and nimble app. It's really easy to use on your phone.
The core of the Count the Kicks campaign centers on a partnership with state health departments and other organizations to make educational brochures, posters, and app download reminder cards available at no out-of-pocket cost to providers. By removing cost as a barrier, the funding organization helps ensure that every expectant mother in that state receives vital information about tracking fetal movement and using the always free Count the Kicks mobile app to keep track of babies' movement patterns. How we launch in a state is replicated on the success that we've seen in Iowa and in the states that came after Iowa. So here is how we would launch in your state. Preparing for the launch. In the initial phase, we will work collaboratively with you to gather information necessary to effectively launch the campaign in your state. We would gather contact information like names, titles, mailing addresses, phone numbers, email addresses of known maternal health providers and birthing hospitals in your state for inclusion in a call and mail campaign. Success has also been seen when social service providers that you regularly interact with pregnant women are included. We review and edit announcement letter to be sent to contact lists along with sample Count the Kicks educational materials. That takes place in the mail campaign, and then we follow up with a call campaign and an email campaign. We also, the state health department is their logo for inclusion on mailing and in the Count the Kicks educational materials. So all the materials that will be distributed to providers throughout your state include your state health department logo on them. In some states, we have multiple partnerships. So in West Virginia, for example, on the educational materials in that state, there is a logo from the West Virginia Health Department, but there's also a logo from the West Virginia Perinatal Partnership. So if you have partnerships like that in your state where you would like to include an additional partner, we can certainly make that happen. So here are the core components to effectively launching in your state. First, customized Count the Kicks materials that we're talking about. These educational materials where providers and individuals ordering Count the Kicks can receive their materials co-branded with your state health department logo. That's those brochures, posters, app download reminder cards, and then state partners, you will review and approve the proofs of those materials with the state logo included. We view this as a true partnership. It's always so wonderful when we have just a great partnership where we're both reaching out to our partners to save babies. The core Count the Kicks printed educational materials are available in English and Spanish, as Talia mentioned. The mobile app is in those 12 languages that are on the screen, and printed materials can be translated into additional languages to meet strategic objectives in your state. And so, for instance, when we launched with Florida recently, they said we are seeing a lot of Haitian Creole families losing their babies, and so they paid to have their educational materials translated into Haitian Creole and printed, and also to have the app translated into Haitian Creole. And we recently launched with Florida within the past month or two, and we already had to have a second run of the Haitian Creole materials because they've been so popular. So if you have a language in your state that you know you would want to reach those families and that population, we want to tailor this program to the needs of the families in your state and the strategic goals that you meet.
Great. So after customizing the Count the Kicks educational materials like Emily talked about, internally we do a special print run, and it's conducted to print enough brochures, posters, and app download reminder cards to reach every pregnant woman in your state over a 12-month period. Our recommended quantity is based on the annual number of live births in the state, and we will keep you up to speed on where you sit with printed inventory that's being distributed, and talk to you about the opportunity to reprint as necessary. Providers will then be able to order materials on our website, have them shipped to their offices, and implement them within their practice at no out-of-pocket cost to the provider. Like Emily said earlier, this truly removes a barrier for providers to get this material for free once you implement this in your state. And so all costs are associated with this deliverable include like printing and warehousing, customizing, all of that is included. So then next, after that, we implement, we call it a mail campaign to reach maternal health providers in the state, a call and mail campaign. After receiving the requested contact list, announcement letter, and customizing the materials, we will conduct a call and mail campaign around the launch of the program in your state. It's really fantastic when we put like the state health department on that, and we have you sign off in it, and we have quotes and things like that. That really just makes it more beneficial and essential and tangible to providers in the state. And we provide free samples of materials directing the recipients where to order additional materials online. So once we send that out, about 7 to 10 days after the sample materials go out, we call every provider on the list and ask if they would like to order Count the Kicks materials. We have a call script. We have callers that do this. They are very well versed in it, and they instruct providers or share with them how to place orders online and offer to place the order for them right there on the phone.
Then after the call campaign, we have an email campaign that will be sent to all email addresses provided on the contact list. Count the Kicks can also provide a draft email to be sent directly by partnering organizations like the State Health Department, willing to share about the launch to their constituents and all of your partners. This email announcement allows recipients to click directly through and order materials online, those materials that the state has made completely for free. So when we did this, for instance, in Kansas, they had a great partnerships already with birthing hospitals, with March of Dimes, with social service agencies, MICV, your home visitors, a whole variety of people. Everyone's on email that can receive this email with all of these free digital tools and resources to really start implementing that campaign within the people that they serve. And so usually there is a personal note from your designated leader about the importance of kick counting, the evidence behind it, how Count the Kicks will help empower moms and save babies. And there is, again, that clear direction to order the materials online. In addition to the call, mail, and email campaigns, awareness of the Count the Kicks campaign is increased when state partners highlight the launch of the program in the media. So we put together an annual PR bundle where we provide an annual series of press releases, templates surrounding major dates like the launch of Count the Kicks in your state. We're just gearing up to send out press releases in all of our partnership states next week about Mother's Day. We also create great valuable information that can be distributed to local press over Stillbirth Prevention Month, which is in October. And then your communications team can share via your communication channels, not just with local media, but you have Facebook and Instagram, Twitter, all of that. You can certainly distribute that way. We can also assist in distributing the PR part of it. We have a national database, an international database of journalists throughout the country and in specific geographical areas. So anytime you want assistance distributing that, that's fantastic. We have ambassadors that you'll hear about in just a minute in 27 states. And so they're fantastic people to have interviewed, in addition to anyone from within your state health department that might want to be on television or the newspaper or radio talking about why you invested in this campaign, why it's important to you, and how you're saving babies, and sparking this highly effective conversation and the highly effective campaign in your state. We provide talking points tailored with your state-specific data and information. As Megan mentioned, we're always tracking the data through either the specific state health department and also through the CDC, and we're always monitoring the specific data that is important to you and your state, including race data, which is highly important to our work. We also offer targeted social media, so strategic placement of social media posts on Facebook and Instagram to reach expectant moms in your state, encouraging them to download the free Count the Kicks app. We know that you can do targeted specific outreach to expectant parents, and that is how we know that we are reaching them.
Great. So on top of all of that, we also offer several different options for health worker trainings. And so when we talk through all this, I know we're going pretty quickly, but we would love to talk to you about it in more detail, specifically for your state if you wish. But this truly is a turnkey program and initiative that has been very successful. So with the health worker training, you'll see on your screen, this is what participants will learn. whichever training you choose. And so it'd be things like how to have the kick counting conversation, how to download and use the app, how to best utilize our free tools and resources, how to respond if an expectant mother says they are experiencing reduced fetal movement, how to answer a lot of frequently asked questions related to kick counting, and then how to share the powerful stories of what happens when expectant parents learn to kick count and how they can use that knowledge to help save their baby. In fact, we just we're notified of a baby save this week of a woman here in Iowa who actually learned about Count the Kicks on social media and noticed reduced fetal movement. And she had just had an ultrasound the day before. And she went in and she was a little nervous, with COVID and everything going on, but she trusted her instinct. She knew she needed to be checked out, and she ended up delivering 4 weeks early. The umbilical cord was wrapped around baby's neck 3 times, and he was anemic, but he is home and thriving today. And it just goes to show you her doctor knew about Count the Kicks, and she learned about it on social media. So there's just so many ways that people can be told about this that are truly saving lives. So when I talk about the 3 types of training, we have an in-person training. This is usually 90 minutes, hands-on experience. We'll educate maternal health workers, such as visiting nurses, childbirth educators, OBs, OB office staff, etc. We also have quarterly webinars that we can do. I would hold webinars for you and your state contacts and your providers in that state. That seems to be a little bit more common due to the pandemic that we're in right now. I'm more than happy to schedule those. I handle everything of scheduling them, setting up the Zoom, and going through the presentation, and it's recorded and sent out. And then we also recently just created a CE course online, and it's called Save Babies with Us, a healthcare professional's guide on talking to expectant parents about Count the Kicks and fetal monitoring. It is available at a discounted rate for our state partners. This training provides professionals with 1.5 CEs and educates them on how to effectively implement Count the Kicks into their practice. So there's quite a bit of options to choose from when you're going through this with us. And then on top of all of that awesome stuff, we also have a lot of in-kind. This is just a few of the items. We do free Count the Kicks mobile app available in 12 languages like we've talked about. Our social media toolkit, digital provider resources available on our website. And then once again, monthly, annual, and we do quarterly data reports regarding the progress of the campaign to your state. We offer regular status calls regarding the progress of the campaign in your state. And obviously, most recently, we have created a lot of COVID-19 resources. We're providing factual, evidence-based information on COVID-19 and pregnancy on our website and social media. We are updating frequently as new information comes in. Because of our educational resources, including the app, expectant parents know when to call their provider and when to stay at home. Kick counting data within the app can even be emailed or texted directly to the providers. A great resource and tool to have, especially right now. It's a helpful way to determine the next best steps for mom and baby. In a time where we are all united and working toward not burdening our health system, we have the solution to help take the pressure off. Through our early warning system, Count the Kicks, we have a community of moms who are in tune with their bodies and their babies, letting providers know when something feels off. Time and time again, the system works. Babies are being saved across the country. Case in point, the Iowa mom that I just briefly talked about went in during this pandemic knowing that she needed to be checked out and saved baby Everett.
Hi, this is Talia again. We have 27 Count the Kicks ambassadors in 25 states and Washington, D.C. And we know some of you on this webinar are from Arizona, Nevada, Louisiana. You all have ambassadors in your state. So let me share a little bit more about what a Count the Kicks ambassador is. Ambassadors are in a variety of states across the U.S. These women are, like me, volunteers who are passionate advocates due to their own personal experiences. And ambassadors attend a variety of events, such as medical conferences, baby fairs. They can give media interviews, work to grow partnerships, fundraise, and much more. What can ambassadors do? So there are several ways that ambassadors in your local region can support this work with mothers and expectant mothers and families. You can invite ambassadors to give a presentation, include them in a webinar and training, a presentation or conference call, much like I am participating in right now. You can ask them to host an educational table at an event, they can help you build partnerships or include them in PR campaigns when you're looking for a local story, a local face to help spread the word. And of course, the overall goal of all of these efforts is to save babies in your state. There is a real life impact of a partnership with us. Please take a look.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
These are just some of the beautiful babies who have been saved by Count the Kicks, their moms and their health providers. Count the Kicks has officially helped save babies in 16 states and 3 countries. These faces are all across the US and are living proof that Count the Kicks works. In many of their stories, their doctors say they would not be here if mom didn't speak up when she noticed a change in movement.
We simply can't thank you enough for joining us on this webinar and having the interest and the desire to learn more about us and to possibly bring Count the Kicks to your state. We would love to open it up to any questions that you might have about this campaign. And I should also mention, I'll be sending an email later today just following up with you. If you missed the full recording, I will send you a link to the full recording. And then as you have questions about, okay, what does this cost for my state? What, and specific questions like that, I would love to have that full conversation with you about what exactly it looks like in your state. And again, that's based on the number of live births that you have on your state, the number of maternal health providers that you have, and things like that. So I would love to open it up to any questions that you might have. I see one of the first questions that was asked is regarding the race disparities that persist and that we believe are completely unacceptable in stillbirth. And so is there any explanation for racial disparities? And so This is obviously something that we study to try and figure out. And I think there are a variety of factors that contribute to the explanation for race disparities. If you study this as well, there's something called epigenetics that contributes to that. If you look at a map of the globe, you will see that African American women are already predisposed to things like high blood pressure, other contributing factors that could eventually lead to stillbirth. That and another thing about epigenetics is, and perhaps you've heard the word weathering as well, and just toxic stress and having that, and sort of what it's like to be treated in many cases as an African American woman in this country, and how it has literally changed DNA. Because of the toxic stress that has existed for so long, so unacceptably in this country and across the world. And that leads to severe health disparities, which again is completely unacceptable. And that's why we're so proud of Dana's story, the video that you just saw of Dana and Nala, that there was a provider who listened to her, and we know that doesn't always happen. And so we know that that's part of the disparities that persist. But one of the other things that we know as far as race disparities is that education levels don't matter. That you could have a college-educated African-American woman compared to a white woman who is high school educated or less, and the African-American woman is still at greater risk of losing her baby to stillbirth compared to her white counterpart who simply finished high school. So we stay up to date on sort of why this is, but more than anything, we simply have a laser focus on trying to reach as many African-American women as we can with our public health campaign, because we know that if they're at greater risk, they need to have this information, as best as we can give it to them. So another question is, given that women are more likely to have stillbirths than a baby with SIDS, why isn't kit counting taught as often? That's a great question, $1 million question that I wish I understood. For some reason in this country, we lose as many babies to stillbirth as we do to infant death. There's a lot of money and resources spent on reducing infant mortality, which is wonderful, and we're so glad that time and resources are spent on reducing infant mortality. But our organization is here to simply make the case that we need as much time and resources focused on stillbirth as well. We look at stillbirth and infant mortality as two sides of the same coin, that if we're going to talk about infant mortality and we're going to talk about SIDS, we need to talk about stillbirth too, because it's all intertwined, right? The health of the mom, the health of the baby, during pregnancy, after pregnancy, it's all interconnected. And so stillbirth needs to be a part of the conversation more than it is. There just aren't many organizations focusing on stillbirth or stillbirth prevention. I don't know why that is. Over the many decades in this country that there hasn't been as much attention paid to stillbirth, but our organization is relatively new in the grand scheme of things. We're about a decade old. And so we've taken it on that we're ready to talk about stillbirth. We're ready to talk about stillbirth prevention. And so to have you as partners here saying that you're ready to talk about it too is significant. It is wildly significant that you're ready to talk about it too. You're ready to talk about it in your state. It sounds like you're ready to talk about putting time and resources behind it as well. And we're ready to go. We're ready to launch this with you in your state and to change this in this country, and to say that, yes, infant mortality is important. We need to put money and resources behind it, but stillbirth is also important. And we need to keep this from happening in as many cases as we can. We know that stillbirth is not always preventable. There are going to be some stillbirths that simply are not going to be prevented. But there are cases where it could possibly be prevented, and that's what we're here for, because there's a method that works. There's a method that's highly effective. It's low cost, and that's exactly what we are. Healthy Birthday is the name of our 501c3 nonprofit. Again, we are a nonprofit, and our mission is not to make money, but to prevent stillbirths and to save babies. And so Count the Kicks is the name of our public health campaign. And so we are excited that you're here and ready to help make this change in your state, and then watch it trickle throughout the country as well. Any other questions I can help answer?
You should be able to unmute yourself. Or if you're having trouble unmuting, you can use the chat box or message us and say, unmute me, because I can do it as well.
Hi, I had a question about Nevada. Someone said that Nevada currently has an ambassador, and I wasn't really sure how it would work since we already kind of have someone for our state. And what would I be able to do to help that?
Sure, that's a great question. Thank you for allowing us to clarify that. These ambassadors, just because there's an ambassador in that state does not mean that there's full funding in that state or that the health department is involved. In Nevada, our ambassador is Julia Taylor. She lost her daughter on 9/11 of all days, not the anniversary of 9/11, but actually on 9/11, she lost her daughter, Sydney. It's another case of where she believes Kit County may have saved her daughter and wishes that she had known. And so she is in Nevada, in northern Nevada, and she is a volunteer advocate. So she goes to baby fairs, she talks with medical providers, but we do not have full funding in Nevada yet. We do not have a partnership with the state health department, but we would love one. And so that's who's funding us in states is state health departments or those third-party organizations like a perinatal partnership or a PQIC. And so basically the ambassador is there to be a voice, to tell her story, to talk about the importance of kit counting to anyone who will listen, whether it's a medical provider or a pregnant mom. And so what you can do, may I ask, are you with the state health department or a different organization?
Can you hear me all right?
I am, yeah.
Okay, I am not. I'm a doula, and I eventually want to become a midwife. And I've had 2 miscarriages. They weren't stillbirths because it was a little early on. But one of the things that I've been really interested in was the stillbirth kind of campaign, helping women through the grieving process after losing a child. And I'd seen Count the Kicks on a Facebook post, and I started looking into that. And I know for me, I've counted the kicks with my babies, but it's been very informal just because it was something fun that I like to do. But after looking at your campaign and seeing just such a huge disparity, I'm an African-American female, and seeing that huge disparity, I thought, oh my gosh, this is crazy. And then we think that our healthcare system is amazing. We're supposed to be one of the best. But seeing how we're still losing babies for reasons that we don't even know, and seeing how doing something as simple as counting kicks can actually help prevent infant deaths, I think that it's something that is really important. And I got on this call because I wanted to learn more about that and to see what I could do within my scope.
Thhank you so much. I am so sorry for the miscarriages that you endured. Thank you for sharing that with us, and know that you're in our thoughts. And I love that you are on this call as a doula and studying to be a midwife, because that's so valuable to women everywhere, especially to have a doula of color is so important. And to have that advocate in the room, we're grateful for what you're doing. We would love to talk with you more about becoming an advocate. There are some states where we actually do have 2 ambassadors. And so we would love to have your voice there, raising awareness among the women that you're serving or in the circles and partnerships that you have already. And so as far as being a midwife or doula helping, we could get you access to all the educational materials, all the free digital tools and resources that you can share as you're talking to expectant women or providers. We would love to talk with you more about that for sure. And we're actively always searching for state health department partners, and we'll continue to do that in Nevada as well. And we can keep you up to date on how, if and when that launch happens in Nevada.
Great, thank you so much.
Yeah. Any other questions?
Yeah, I have a question. How would we know how to reach out to Julia Taylor if we wanted to? I live in Nevada too.
Oh, fantastic. I can give you her email, and in fact, I'm going to type it in the chats right now. It is,
okay. That'd be great.
Yeah. There you go. That is her email right there.
Oh, thank you.
Thank you. Any other questions I can help answer?
Yeah, someone mentioned that there are times when, the way I took this was that there have been times where doctors haven't really known how to talk to their patients about kit counting and I guess stillbirth. And I wanted to get a little bit more information on that, or maybe clarification.
Sure. Providers have known for decades that tracking fetal movement is important. It is something that has been common knowledge for decades among obstetricians. However, until our founders came along, there was no concerted effort in our country or a campaign created to have the tools and resources as a provider to spark that conversation with moms. So it's something they know about. It's not necessarily something they remember to talk to moms about. And that's our main purpose in life as our organization, is to provide everything that's needed to spark that conversation, to remind them to have the conversation, and to give them all the evidence-based, and that's key, these are all evidence-based tools. They're proven tools and resources to save babies. And we follow the research. We go to this National Stillbirth Summit that's held every other year in this country, and the International Stillbirth Summit that's held every year. It was in Spain last year. And so quite honestly, what we're learning as we talk to more and more providers across the country, and also additional providers across the country, that unless they're reading a green journal every day or every week and looking for stillbirth prevention information, we are the ones bringing the research back to this country and providing it so providers can read up on it on our website or on our social media and through emails and things like that. And so I'm not sure if I answered your question correctly, but that's kind of the history of it, is that providers do know that it's important, but there are so, in my opinion, I think there are so many things that to talk about during the prenatal space, like folic acid and sleeping on your side, and just so many things that they're talking to them about. And our organization and any advocates that want to join our cause is that our job is to bring it top of mind, to have the conversation in a positive way. Stillbirth, and this is from our founders who experienced stillbirths themselves, is, stillbirth is a very sad topic. It's tragic, it's awful. And they wanted the campaign to be bright and empowering, and that's exactly what it's become. So it's a way to talk about stillbirth, but making it positive and empowering for the mom, and not making it a quote dark cloud or something like that. It's a way to talk about stillbirth in a positive manner without striking fear in someone or making it filled with anxiety. In fact, we have a survey to that point. We have a survey on our app where at the end of the pregnancy, we survey our app users and we ask them, did this app make you more anxious? Did it make you less anxious? Did your anxiety level stay the same? And overwhelmingly, the answer is that it has helped reduce their anxiety, that they had less anxiety. And here's why I think that is, because instead of having a mom all of a sudden feel a change in movement and not know what to do with that information, we now have moms who have evidence of what's normal for their baby and whether or not it's still staying normal or if it's changed. And they have data in the palm of their hand that they can show to their provider within that app and say, look, this is what used to be normal for me, and here's how it's changed, or here's what's remaining normal. And it helps them have that conversation, but it also helps them know it's that data. We call the app a data download for mom's intuition. So providers also like what we're doing and like the fact that the app exists, because instead of having a mom who's not quite sure what is normal or if something has changed, you now have a mom who is completely informed and has been in touch with what's happening with the health of her baby and her baby's movements, and can speak up and let you know the real data that something has changed. So for instance, if normally it took your baby 10 minutes on average to get to 10 movements one day, and all of a sudden it's taken 2 hours, that's something you want to tell your provider about, because a difference of taking 10 minutes to 2 hours is quite different and quite significant. And your provider needs to know that so that they can take the steps necessary to see if there needs to be an intervention or not. And so they could run an ultrasound, they can see the umbilical cord, they can see what's happening inside. In Ruby's case that you saw, that Good Morning America story at the top of the webinar, doctors ran the ultrasound after mom complained of reduced fetal movement and noticed that she wasn't moving her ligaments. She could not move her fingers or toes. That's what they noticed on the ultrasound. And so then they made that highly informed decision to get baby here through an emergency C-section and to get her here safely and quickly and alive and well. And so what we're here to do is bring those tools and resources so you have a highly informed and in touch mom instead of one who's not quite sure what to do with the knowledge that who knows and realizes in her gut that something is different but doesn't know what to do with that information. I hope I answered your question well enough.
Yeah, definitely. And I really appreciate you adding that part about empowering women. I think that's something that is amazing, rather than looking at counting the kicks as something that should be kind of depressing, but it's something that puts that power back in the mom's hands to say, hey, I know what's going on with my baby. This is fine. And I know sometimes we get kind of nervous and we think, oh no, I haven't felt the baby. But when we take that moment to step back and actually feel those kicks, then all of a sudden the kicks come in. And so I think that I really like that. So thank you for your explanation.
Thank you. One of the things that we know is that women, especially as we have held focus groups with women of color, is that yes, we have made this campaign bright and empowering, but we also don't believe that women are delicate flowers. We believe they can handle the information that stillbirth does happen. Talia mentioned in her story that she was never told. And we wish that she was told that stillbirth does happen. And it happens at the alarming levels that it is happening. And so we do find it empowering because we don't think that women are delicate flowers, that they do are empowered to track their baby's movements and speak up if they notice a change. So thank you for saying that. Any other questions I can help answer?
Hi, Emily and everyone on the call. This is Jennifer McCune. I am an ambassador for South Dakota. My son Danny is a baby save, and I just wanted to add to that conversation, if I could, about the healthcare providers, because a component of that I think is a real key that actually saved my son Danny. And that the evening that he was born and I recognized that I had the reduced movement, I had a moment where I almost talked myself out of it, because I had an appointment the next morning and I thought, I don't want to be burdensome to the doctor. I'm sure this is something that can wait. And at a previous appointment, she had told me it is not my job to worry, it's her job to worry. And if I ever had a concern, that I should call her no matter what time. And if she hadn't said that to me, I don't know if I would have made that call. So that's kind of stuck with me over time. It's just another message for the healthcare providers, is to give that assurance that this information is a tool to let them know that it is okay to make that call, right? That's helping them. They can follow their instincts. They can follow the data from the app, and it's okay to call and talk to the doctor about it. They don't need to self-diagnose it. Contact their provider.
Absolutely. We appreciate that, Jennifer. And thank you for speaking up. Danny, her son, is actually the very first baby that was ever saved by Count the Kicks. And am I right that is he turning 13 in October?
In December he is, yes, 13.
Very exciting. Thank you, Jennifer, for sharing. Any other questions?
I think Talia mentioned that we could get our state's information, like our statistics and things. How, where do we sign up to get that information?
Would you mind putting in the chat your name and email address, and we will send that directly to you, and also the state that you're, I believe you're from Nevada, is that right?
Yes.
Perfect. We will get that to you.
Thank you.
Any other questions we might be able to answer? Again, I'll be following up with all of you with some state-specific information. We would love to have a further conversation in your state about how we might be able to launch there. And so we just greatly thank you for your time today.
Awesome.
Thank you.
Thank you. With that, we'll stay on for just a couple minutes, but feel free to log off. If you have any other specific questions, we'll be on here for just a couple more minutes, and then we will go ahead and close out. So thank you, everybody. Enjoy your day and be safe and healthy.
Hi, I guess this is Jan Hauk. I'm in Nevada. I do have, I don't know, a comment for Emily, because I'm no longer part of Maternal Child Health Coalition in Nevada, and I was part of FEMR, Fetal Infant Mortality Review in Northern Nevada. And at one point we wanted to implement some type of kick count, but talking to the OBs here and in California is finding documentation, honestly, of the effectiveness of it for research-based rather than anecdotally. So that's why we were not able to move forward. So if I email you, would we be able to find, actual research, true research, I forget the terminology for it, to help us get this through as part of Fetal Infant Mortality Review?
Yes, absolutely. Thank you so much, first of all, for your efforts of already trying to do this. We're deeply grateful for that. And I know it's not always an easy road. Would love to share the evidence behind kick counting with you. We'd love to. And so would you mind stating your name one more time?
Okay, this is Jan Hauk, H-O-U-K. And I'm only here because I was always interested, but I'm no longer part of all the organizations because I changed jobs. So what I'll probably do is contact the person currently running FEMR and see if she could reach out to you, just because I'm not part of it anymore.
Oh, that'd be perfect. Thank you. One other thing we didn't mention, in addition to the research on kick counting in general, is we have a research study that is just wrapping up on Count the Kicks app users. And in fact, right now they're currently writing the manuscript for the research project that happened over 1,000 moms who used our app.
Okay.
Were studied and gave a lot of great information. I wish I could reveal what the results are. Unfortunately, I can't.
Right.
But it's very promising and quite good. And so as soon as that comes out, we'll be shouting it from the rooftops and can send it to you as well, so you know specific research on Count the Kicks app users. And one of the things that we were examining was not only how the app served them, did it serve them well, did it raise anxiety, did it lower anxiety, those kind of questions. We also looked at comparing the stillbirth rates of women who didn't use the app compared to women who did use the app. And so that should be coming out. Who knows how long it will take to go through the process of getting the research approved and published, but the manuscript should be done here within a couple of weeks. We've been working on this for 2 years now, and we're really excited to get it out there. So in addition to general sort of fetal movement research, we will have that as well soon.
Okay, yeah, because that honestly was, that's really what prevented us from convincing the OBs to consider it and to go public with the campaign. So yeah, I'll reach out to the person that runs it in FEMR now and give her your information, and hopefully she can reach out to you, because we work with the Northern Nevada Maternal Child Health Coalition, but I don't know if anybody else from that is on here. I didn't recognize any names. So yeah, I'll work on that. So thank you so much for doing this.
Well, Jan, thank you so much for following up, and even though you're not there anymore, for participating, and that's just amazing. So we're really grateful. Thank you so much.
All right, thank you.
Be happy to answer any other questions if you have them.
All right. I think I will go ahead and close out everything. Thank you all. And Emily will be in touch with an email with the recording and anything else. So thank you. Have a great day.